Hello, I'm Dr. Thierry Hertoghe, and I'm the president of the International Hormone Society, which is probably the third most important endocrine society internationally for physicians. And I want to talk now on vasopressin, the importance of vasopressin. Vasopressin is a hormone who's widely important. When you look at an older patient, you often see that he's full of small little wrinkles, little folds of being dried out, dehydration folds. Well, actually these folds can be due to a lack of vasopressin. Vasopressin is a hormone who keeps water in the body, especially at night, but also during the day. And especially it keeps the water on the skin. And it's actually, many people want to look better. And so what do? They inject Botox because they find they're aging, and Botox paralyzes, it's a toxic that paralyzes the muscles, and then they seem to look better and seem to be less wrinkled. But what does vasopressin? Vasopressin makes there's more water in the skin. And so it takes all the folds, not only there on the forehead or somewhere on the face, but on the whole body. And so vasopressin does Botox in a safe manner everywhere. Of course it works only if you have a vasopressin deficiency. So you should check with your physician, or the physician should check in you if there's a vasopressin deficiency. And one of the ways to check is also to know if you have to go to the toilet at night. If you don't have enough vasopressin, you have to go much more often to the toilet at night, and you urinate large volumes because you cannot keep the water in the body. So that's another problem. People who have vasopressin deficiency may also have memory problems and difficulty to learn. They go to conference and they forgot what they heard. They read a book and they forget what was in the book. So vasopressin can also help this. And how do you take vasopressin? Well, vasopressin, you take it by putting some drops. There's a little vial where you can put some drops in your nose before bedtime. And you can take also a little bit before in the morning, because vasopressin only stays about 12 hours, 10 to 12 hours in your body. So you need to do every 12 hours some, but you need more at night than you need in the morning. So this is very important, and it's probably one of hormone that's probably anti-aging, but it's also very good for your health. People have seen that people who don't have enough water, who are dehydrated, also may have an increased mortality. For instance, elderly people that have come in the hospital because they had dehydration problem, more than half of those will die in the next year, as has been seen in a study in the United States. So this is just to put the accent how important it is for vasopressin. I thank you for your attention.